Okay, this video is why is a low-fat, whole food, vegan diet the best one for hypertension? And by the way, I've made several videos that go into great detail all about what causes hypertension, how to prevent it. But the reason for this talk is a viewer had asked me, what can they do to prevent hypertension or cure hypertension? So I'm just going to focus on the treatment aspect and keep this video relatively brief. Okay, and also, here's a book that goes through everything about this in much more detail. But you don't need the book. All you got to do is watch a couple videos. All you got to do is watch this video. But I can tell you, hypertension is super common. It's the most common cause of atherosclerosis. That and elevated cholesterol. It's the most common cause of strokes in the brain. You know, diabetes, atrial fibrillation are major causes of stroke as well. But the most common cause of these small strokes I see all day long, every day in the brain are hypertension. Okay, if a person's taking any medications for hypertension, you need to work with your doctor or your healthcare provider to titrate the dosages. Because otherwise, your pressure could drop and you could pass out, so you don't want that. Why do we have a blood pressure? We have a blood pressure to get blood to our brain. You have to pump blood to your brain against gravity. That's the highest thing on your body of significance. So you need blood pressure to get blood to your brain, and your blood pressure is largely titrated by the ability to get blood to your brain. And that's highly important because you want to watch out for overtreatment. If you overtreat hypertension too powerfully, let's say with medications, you're not going to get enough blood supply to the top of your brain, your cerebral cortex, okay? And that's not good. That can cause confusion. That can cause a loss of consciousness. You pass out. Not good. Okay. And by the way, normal blood should be like water. Relatively thin, we'll just say, versus thick blood is bad, because when the blood's thin like water, you can pump it to the top of your brain with a relatively low pressure. When the blood is thick, like a milkshake, then it's going to take more pressure to pump it up to the top of your brain. So what causes hypertension? In general, anything that makes the blood thick. Okay. Also, in general, anything that narrows the arteries. Vasoconstrictor is to narrow the arteries. So, first question is, why is fat bad? In general, fat is bad because, in general, fat tends to stick red blood cells together, okay? So especially the chylomicrons, the beginning of fat absorption into the blood, and also the LDL cholesterol. So saturated fat's especially bad for this, and so are the PUFAs, omega-6 PUFAs, okay? And people say, well, omega-3s are good. Well, omega-3s do have a little bit of a blood thinning effect initially, but they cause obesity. They contribute to obesity. They contribute to immune suppression. They contribute to insulin resistance, so I'm not a fan of omega-3s. I know a lot of people are, but I am not. Okay, what else about it? The thickening of the blood by sticking the red blood cells together is called blood sludge. It's also sometimes called rouleau formation. Rouleau means a stack of coins in French. So the blood sludge means thick blood. Pressure has to go up to pump thick blood to the top of your brain. So that causes hypertension. Why is sodium bad? Salt. Because sodium is a vasoconstrictor. And that means it causes narrowing of the arteries. It inhibits the endothelial, the arterial lining cells, production of nitric oxide. Nitric oxide is the most important vasodilator, thing that opens up arteries in the body. So if you inhibit that, you get hypertension. Okay. Now, dietary sodium, if you just eat normal amount without adding anything to your food, you'd be nice and low and you'd be fine. How much you add, there's threshold effects. I'm not going to go into any detail, but I just recommend in general not adding sodium to your food. Or if you add any sodium to your food, just sprinkle a little bit on your food right before you eat it. That way it's on the external surface of the food and you taste it, versus you don't want to be mixing large amounts of sodium into the food when you're cooking it, because you don't taste it as much and you can get your sodium levels very high by doing that. Processed food tends to be really high in sodium. And people often put a lot of sodium on meat. It makes it taste better, and it's also a preservative. Why is high fructose corn syrup so bad? Because it elevates your blood level of uric acid. That elevated uric acid in the blood, it's a vasoconstrictor, and it also causes insulin resistance. Insulin resistance means predisposes you towards increased risk of diabetes. Diabetes over time contributes to high blood pressure and other problems. Large amounts of high fructose corn syrup also increases your risk of fatty liver. As a matter of fact, you don't want to be drinking alcohol either. Alcohol is bad. Alcohol and high fructose corn syrup have a similar effect on the liver. They both tend to get converted into liver fat. So there's a guy by the name of Lustig. He's sort of a famous pediatric endocrinologist, and he has a great YouTube talk called The Bitter Truth about sugar or something. But and don't get me wrong, he exaggerates. He promotes the low carb, all that crap, paleo keto. But why do I mention his stand? Because he did say something funny about high fructose corn syrup. He said high fructose corn syrup is alcohol without the buzz. I thought that was a rather clever statement because they both get converted into acetyl-CoA, a 2-carbon molecule in the liver that gets made into fat. So they both cause fatty liver, and fatty liver is like diabetes of the liver. So you shouldn't drink any alcohol at all, none, zero, and you should also avoid anything with high fructose corn syrup in it. I wouldn't eat anything that had high fructose corn syrup in it. Okay, what foods are high in fat and in sodium? Animal foods and processed foods. So they're double bad. They're screwed from the beginning. And animal protein has a lot more branched chain amino acids like leucine, for example, and that creates an effect in the body that tends to increase blood lipids as well. Okay, and it activates mTOR. It does bad things you don't want. Why are potassium and magnesium good? By the way, P for potassium, P for plants. Okay, magnesium is located in the center of chlorophyll. So when you eat plant foods, you'll tend to get good amounts of magnesium and potassium. They tend to dilate arteries. You need both of them to run your plasma membrane ion pumps. And you need those ion pumps functioning well to be able to manage your calcium well inside your vascular smooth muscle cells, the muscle cells around the arteries. And if you don't have it, most Americans eat way too much sodium and then not enough plants, so they don't get enough potassium and magnesium. That leads to vasoconstrictor, the vasoconstrictor effect of sodium. When you eat a lot of plant foods, you get plenty of potassium and magnesium, and they tend to be low in sodium, so you get what you want. Our ancestors ate a diet high in plant foods, high in potassium and magnesium, causing vasodilation. The opposite of what the modern person does with the standard American diet, where it's high in sodium but low in potassium and magnesium. Okay, so as far as potassium and magnesium vasodilators help open up arteries. You want a K-factor ratio of at least 5-1. So K-factor ratio, that comes from the work of Richard Moore, MD, PhD, who devoted his whole life to studying ion pumps and their relationship to hypertension. And what he basically says, at a minimum, you should eat 5 times more potassium than sodium. In reality, if you're eating a plant-based diet, you'll probably easily be like 10-1 or 20-1 more potassium than sodium. So it's a non-issue. The body's good at excreting out potassium. The only exception is if a person has advanced kidney failure, then they might have trouble excreting potassium. So if you have kidney failure, then you have to be careful about this. Consult your healthcare provider and ask them what works for you. Why is dietary fiber such a good thing? Because it prevents leaky gut. It feeds the good gut bacteria. They convert the dietary fiber into short-chain fatty acids, in particular butyrate. The butyrate's used by the lining cells of the gut epithelium, enterocytes you might also call them, to make tight junctions so you don't get things that don't belong getting absorbed across your gut lining. If you have leaky gut, there's a tendency to get what's called postprandial endotoxemia. Prandial means to eat, so postprandial means after eating. Endotoxemia means endotoxins, which means they come from bacteria. And the two big ones are LPS from gram-negative bacteria, LTA from gram-positive bacteria. And these things will predispose your blood to clotting. They cause a change in the shape of a blood clotting protein called fibrinogen. And it's called an amyloid clot, means it's an especially bad type of clot, relatively refractory to being dissolved. So anyways, you don't want that. Okay, and the way you prevent it is get plenty of dietary fiber. There's a few other things to know, but that's the key point. And again, I got lectures on all this stuff: how to prevent leaky gut, how to prevent hypertension, what's the deal with fructose, all this stuff. I'm just going over this to help somebody who just wants to know what do they need to know to help have better control of their hypertension. Why are leafy greens related nitrates so good? Because they're precursors to make nitric oxide. It's a pathway where you get a partial conversion in your tongue. The nitrates are NO3, nitrogen with 3 oxygens. On the back of the tongue, there's bacteria that convert them to nitrites, that's NO2. And then in the stomach acid converts them to nitric oxide. And then they go into your blood, and they're a systemic, throughout the body, vasodilator to open up arteries. Plants also have lots of antioxidants, which are beneficial to arterial health and help prevent atherosclerosis. So the bottom line is you get the good stuff from plants. You get the bad stuff from animal foods and processed foods and oils. Okay, why do some people recommend avoiding toothpaste that have this stuff in there, or mouthwash with that stuff? Why are stomach acid blocker medications bad? because they diminish the ones that have these powerful toothpaste. They can wipe out the bacteria on the back of your tongue, so you lose that initial step in the nitrate conversion pathway. The acid blocker medications will decrease the ability of the stomach, having the acid necessary to convert the second step of the nitrate conversion pathway. You won't be able to convert your nitrites to nitric oxide, so that can also contribute to hypertension. Other things that are important for preventing hypertension or minimizing hypertension is, try to manage your stress, because stress elevates the hormones cortisol and catecholamines, which raise blood pressure. Usually it's a relatively minor effect, but manage your stress, try to get adequate amounts of sleep, avoid caffeine. All of those things help to prevent hypertension. Because in the United States, where people tend to eat a lousy diet and they're stressed out and they drink a lot of caffeine, it's routine. Most people are hypertensive in middle age and their older years. Versus you go to some of these countries where they still eat a plant-based diet, low-fat plant-based diet. They're skinny. They don't ever get hypertension. They got the same blood pressure when they're a teenager as they are in their 70s. Look at the Tarahumara. Look at the Yanomamo. Look at other populations like that. So anyways, I hope that's helpful.